Ever thought about a career move that's got sun, cutting-edge tech, and patients from all over the world? Well, securing your dental license in Dubai is an incredible opportunity, and this explainer is going to be your step-by-step guide to making it happen. So, let's jump right in. So, you're picturing it right? Practicing dentistry with a view of that famous Dubai skyline? I mean, it's an awesome goal to have, but to make that dream a reality, there's one really important checkpoint you gotta pass first.
Yep, that key is the Dubai Health Authority exam, or the DHA exam. This is the big one. It's a required computer-based test that basically makes sure your clinical skills are up to Dubai's super high standards. Passing it isn't just a box to tick, it's basically your professional passport to practice in the city.
Okay, so first things first. Before we even think about study plans or booking exams, we've got to make sure you're actually eligible. Let's walk through the foundational requirements you'll need to have in the back. So, the DHA has this framework they call the Professional Qualification Requirements, or PQR for short. Basically, what that means is you need a recognized dental degree, you need to have completed a one-year internship, and you need at least 2 years of clinical experience after that internship. You'll also need a recent good standing certificate, and this is super important. Always go to the DHA website and download the latest PQR document yourself. Why? Because these things can change. So once you've checked off all those eligibility boxes, you're ready to get the ball rolling on the actual process. I know it can look a little intimidating at first, but trust me, it's a pretty straightforward 5-step pathway. Let's map it out. Okay, here it is, your roadmap from start to finish. You'll kick things off with the DHA's self-assessment tool for a quick preliminary check. Then, you'll create an account on their Shirion portal and start uploading your documents. Step 3 is initiating what's called Dataflow verification, which confirms all your credentials. After that's done, you'll get the green light to book your exam. Pass that exam and boom, you're on to the final registration step.
Okay, so you might be wondering, what is this Dataflow or PSV thing, right? Well, the easiest way to think about it is like a professional background check for your credentials. A third-party service literally calls up your university, your past employers, and your old licensing boards to make sure all your documents are authentic. It's a really key step to make sure everyone is legit. And hey, here's a little pro tip for you. You can and probably should get this process started while you're studying for the exam. It'll save you a ton of time down the road.
All right, now for the main event, the exam itself. You know what they say, knowing what you're up against is half the battle. So let's break down exactly what you can expect when you sit down for the test. So let's get into the nitty-gritty of the exam format. It's a computer-based test, and you're going to see about 150 multiple-choice questions. You'll get around 165 minutes to finish it all, so your time management has to be on point. You're aiming for a score around 60% to pass, but just remember, that number can sometimes change. All in all, it's a pretty direct test of your clinical know-how. Okay, this is huge. This is where you need to focus your study time. Now, the DHA doesn't hand out an official blueprint, but this is a really solid breakdown of what's on the exam. You can see right away that restorative and endo make up a huge chunk of it, but prosto, perio, oral surgery, and peds are all major players too. So what's the big takeaway here? It's simple. You absolutely need a balanced study plan. You can't just focus on one area. You've got to cover all these core subjects. It's non-negotiable.
Knowing what to study is one thing, but knowing how to study, well, that's what gets you a passing score. So let's talk about a practical 12-week game plan that will take you from day one all the way to being exam ready.
Okay, so we're breaking this down over about 3 months. Here's how it works. In the first couple of weeks, you're just getting oriented, figure out your study space, and most importantly, take a baseline test to see where your weak spots are. Then for the next month, you are systematically hitting every single topic. After that, for 3 weeks, it's all about integrating that knowledge with timed practice questions. And those last 3 weeks, that's when you do full-length mock exams and your final high-yield review. See how that works? You're building momentum and confidence week by week. All right, we're in the home stretch now. This last part is all about taking all that hard work you've put in and turning it into a definite pass. Let's talk about the strategies that really work, the common mistakes to avoid, and how to walk into that exam feeling totally ready to crush it. This is really where the rubber meets the road. Look, the people who pass this exam focus on active learning. They're hammering high-quality question banks, and they're doing full-timed mock exams. Where do people go wrong? By sticking to passive review, just rereading old notes and kind of ignoring those minor topics like ethics or infection control.
Honestly, the biggest mindset shift you can make is to stop just reading about dentistry and start solving clinical problems like you're against the clock.
Seriously, if there is only one thing you take away from this entire guide, let it be this. The DHA exam isn't a trivia contest. It's not about memorizing isolated facts. It's all about testing your clinical reasoning. You'll get these patient scenarios and have to figure out the diagnosis, the next best step, the right treatment plan. You have to connect the dots, create a logical pathway from diagnosis to treatment, just like you would with a real patient in your chair.
And finally, exam day. This is it. It's all about execution. Get there early, have your ID and confirmation ready, eat a light meal, use that little tutorial time they give you to just get comfortable with the interface. Read every question carefully, eliminate the obviously wrong answers, and then trust your gut. Don't go crazy flagging questions, and please resist that urge to make a bunch of last-minute changes. Look, you've put in the work. Trust your knowledge. Just go in there and let all that preparation shine.
And there you have it, the complete roadmap, from that first dream to holding your DHA license. The process is clear, right? The exam is tough, but it's absolutely manageable. And the opportunity that's waiting for you on the other side, well, it's incredible. So now you've got the guide, you have the roadmap. The next step, well, that's up to you.